Hello everyone, I'm Marvin Plackett, and today is Wednesday, May 6th. Greetings to all residents, all staff, and all guests. Pleased to report that once again we have no new confirmed cases of COVID-19. You will recall that last week we had a confirmed case from someone that works in the kitchen. No new cases since then. And very pleased about that. Let's remember some key things. And again, focusing on the facts and not the fears. Remember that roughly 30% of those that test positive for COVID-19, let me restate that differently, because most that don't have any symptoms, they're not even tested. But when studies have been conducted in a broader way in society, those studies have shown that roughly 30% of those that have COVID-19 have no symptoms. Right? They're symptom-free. That means that we really don't know how many cases of COVID-19 could be amongst us right now at Episcopal homes. That is possible. In fact, it's painful to say this, but it's in fact likely that there are some cases on our campus that we have no idea about it based on the studies that have been conducted. That means that it is so important that we remain diligent, vigilant with the practices that we have in place. If you or I have it, but if we are practicing the sound principles of social distancing, which means staying at least 6 feet apart, wearing our masks anytime we're not in our apartments or in our units, in our rooms, so that if we do come within 6 feet, that we have muffled that potential exposure from those droplets from our breath, right? So that we have contained them. Frequent washing of hands. Remaining in our communities and in our zones. If we are practicing those all the time, even if I have COVID-19 or you do, you're not going to pass it to your neighbor, to a staff person, or to a resident, to a friend, to a loved one, right? You're not going to do it. And if you are practicing those rules that we have in place. And so they're so important. Yesterday I talked about proper putting on and wearing of the mask. I just want to remind you of that. Remember that this is not effective. This is minimally effective, or let's say not effective. Where just the mouth is covered, that's not okay. We need to cover our mouth and our nose. This is effective. Okay, that's the proper way to wear the mask. So very important. And then also, after this, let me just put this down. After my talk yesterday, a resident, thank you very much, for reached out to me and said they appreciated those instructions, and they asked me to also explain what is 6 feet, because some people don't necessarily think about what does 6 feet mean. And also, social distancing, really that means physical distancing, right? It means staying at least 6 feet apart. So if you're wondering how far is 6 feet apart, because 6 feet is not 2 feet apart, or 3 feet apart, or 4 or 5, 6 feet apart at a minimum is full 6 feet, which means that if you are 6 feet tall, okay, that's how far away, that's a good measure. Or if you're not, think about your arm is about, roughly speaking, 2 feet long. So you have to be at least 3 arm lengths apart from one another. That would be 6 feet, and that's the minimum that you want to stay apart, all right? So very important that we continue to employ these practices, that we be very vigilant, because COVID-19, again, is actually probably amongst Episcopal homes, residents or staff, or both, based on the studies. But with these sound practices, we're not going to spread it to one another. Very important. A reminder that, of course, this upcoming Sunday is Mother's Day. And, you know, it's really painful to not have my children come to my house. I really regret the first time ever that my children are not going to come to our house to celebrate Mother's Day with my wife and me. I know that it's painful for you to not be able to do that. Once again, Governor Walz, until May 18th, has the stay-at-home rules in place. Really important that we not mix socially with our family, as painful and difficult as that is to implement and to live by, adhere to. We must do that. You know, I just finished talking about the definition of 6 feet. How can we measure that? How can we know we're staying at least 6 feet apart? And it is really difficult to do that. For me at least, and I'm sure it is exactly the same for you, it's really difficult because I am a social being. I would love to go up to you because so many times I see you in the hallway, residents, staff, and I'd love to give you a big hug and certainly talk in a normal way, 2 feet apart or something like that, and to not wear a mask. That's what I'm wanting to do as a human being. And so the pain that you're feeling of having to stay at least 6 feet apart and wearing the mask, I want you to know that I absolutely feel that pain. Every time I'm near one of you, I so badly want to give you a hug with a big smile and converse closely. We can't do it though. We have to endure the pain. We have to endure the experience. Let's not view it in a negative way. Let's just say this is the kindness and the love that we must show to one another at this time so that we're taking care of one another. Lastly, I want to do a huge shout out to our nurses. Today is the first day of National Nurses Week. Our nurses are heroes, absolutely, as has been stated by so many people at the national level, local level, state level, local level. Those that are first responders, those that are working in hospitals, those that are working in long-term care, and in other settings. Nurses, shout out to you. Thank you for the fantastic work that you are doing, especially at this time where the risks are higher and the good is so great. So big shout out to our nurses. And to all of our residents and fellow staff members, I put this challenge to you. Reach out to a nurse. Reach out to a nurse today. Reach out maybe to a nurse, a different nurse, every day for the next 7 days. So it starts today, National Nurses Week, ends on Tuesday of next week. So for these 7 days, National Nurses Week, reach out to one, send them a card, make a phone call, whether they work here at Episcopal Homes or somewhere else. I know you all know, we all know nurses, right? Reach out to one, tell them happy National Nurses Week, and then whatever else loving words of support that you want to give, be fantastic. Be sure to do that. See you tomorrow at 1:30. And now for some words from Kiri Meyer-Quist. Kiri Meyer-Quist is the manager of Seabury. So many of you know her well. She's been here at Episcopal Homes almost as long as I have been. Delighted to have Kiri joining us today.
Good afternoon. Marvin introduced me. I don't need to introduce myself, but thanks for having me today. I would first like to give a big shout out to the Cornelia and Seabury residents for taking such good care of each other during this time. You've shown such great compassion and care for one another, and it's such a wonderful thing to see. Like me, I'm sure many of you are missing that sense of connection and community right now more than ever. But we will stay strong together and get through this pandemic and come out stronger on the other side. I know as we are all trying to best cope with the confusion and uncertainties that we're facing today, it's hard to feel hopeful. But I hope you can be grateful for some of the things that we do have, like our great leader that we have at Episcopal Homes here, that it keeps us informed each day, the awesome staff that are keeping us safe and looking out for each and every one of you, your resident neighbors who are truly caring for each other. These things give me hope and joy, and I hope they do you as well. Always know that we at Episcopal Homes love and care about you and are doing everything we can to keep you safe and healthy. I look forward to the day when I can give you that hug again. And remember, everything is going to be okay. Have a great afternoon. I will see you soon.